Hi, it's Eric Hartman again with the International Choroideremia Research Foundation, and I am here in Lausanne, Switzerland, at the International Society for Genetic Eye Disorders and Retinoblastoma, and I am here with one of the rock stars of international retina patient advocacy, none other than Miss Christina Fasser, who was one of the main reasons we have Retina International. So, Christina, it's very nice to talk with you.
Thank you very much, Eric. Now you give me too much credit. There were many people making up Retina International, and I think one of the pillars were Gordon Gant from the United States, Luli Gant, his wife, Claudette Medefriend and Gordon Cousins from South Africa, Linda Cantor from the UK, and many others. So this was really work being done together.
It is a huge team effort, but certainly
absolutely.
you're one of the international leaders, and we greatly appreciate it. The Choroideremia Research Foundation is, I believe it may be called an associate member at this point with the Retina International. Hopefully they will determine that we can join in full. We're looking forward to it and to our meeting potentially next year in Reykjavik. And I also have representatives from the retinal research arena here in Switzerland. Gentlemen, why don't you introduce yourselves?
Thank you, Eric, for this interview here. So my name is Pascal Escher, working in Bern, the capital city of Switzerland, in the university hospital, and we are trying to implement in our hospital, in the eye clinic, to join the clinical examinations together with the electrophysiologic and genetic analysis, that we can provide the patients with a precise diagnosis. And in Switzerland, the situation is comparable to the rest of the Central Europe, with the incidence of retinal dystrophy, among them choroideremia. And we are, of course, very much interested to have this interaction with you, Eric, and your organization, that we are always have the best information, what you know about the research is going on around the world.
Well, thank you, and it's good to know that he has also just agreed to sign up to our International Choroideremia Research Network, and it will be good for us to be able to pass information on to your patients that have choroideremia and to keep them informed of all the types of research that's going on. And then over here, representing Retina Suisse, correct?
Yes.
Okay.
I'm Stephan Hüsler. I'm the CEO of Retina Suisse. I stepped in the office after Christina left, so it's a bit history. We can say Retina Suisse was founded in 1979. So we celebrated the 40th birthday 2 years ago. And it was a family project of the Fasser family. So her brother was the first president, and Christina stepped in after him and built up the association, so that at the moment we have about 1,500 members throughout Switzerland. Most of them have inherited retinal disorders, some about a bit less than a third, a fourth have age-related macular degeneration, and that's our population. In the inherited part of the membership, we have some choroideremia cases, not that much, and as we discussed yesterday, I think it is mainly because of the lack of genetic analysis that we don't know how many patients with this devastating disease we have in Switzerland. I think this is a problem all over the world. Get your proper diagnosis confirmed by genetic analysis. It's a problem we have all together.
Absolutely.
I think it's really the problem of those that have been diagnosed, say 5 to 10 years ago and earlier. They very often just get either they have just RP or they get X-linked RP, and I'm pretty sure that among those having the label of X-linked there are choroideremia and vice versa.
Yes, we had one woman, she and her son were diagnosed clinically and then genetically tested to have choroideremia, and it turns out she has 48 relatives in Ireland that were living with an RP diagnosis. So it's widespread, and it's certainly something that all of us in the inherited retinal disease arena are trying to get clinicians to realize it's time to reassess those clinical diagnoses. I want to thank each and every one of you for your time. Do you have anything else you'd like to say?
I would like to wish you good success, and I think choroideremia is really something worth to look at. Even we've had a little bit of deception that things are not working out so quickly as you might have wished, but all these failures give also the possibility to learn new things, which will make sure that at a certain point we will succeed.
It is research, so even though there are sometimes roadblocks, it just means we need to go to a new direction. So there'll be more from this conference here in Lausanne over the next couple days. We had a wonderful talk yesterday by Jean and Al, or Jean Bennett and Al McGuire. They gave a wonderful talk about their work with Luxturna and LCA, but also talking about their research with choroideremia. And we will certainly hear tomorrow, there will be a wonderful speech from Dr. Ian McDonald on his career in research of choroideremia. So that's it for now. Thank you very much. We'll update you later.